Colorectal cancer is the third most common cancer among adults. It's also the most preventable and treatable cancer if it is detected early. Joining me now is Dr. Joseph DiRocco, Medical Director of GI Oncology at GBMC. Welcome.
Thank you, Elsa.
Happy to have you here. So tell me a little bit more about your role at GBMC.
Well, I'm the Medical Director for the GI Oncology program, and it's a new program that was started at GBMC a couple of years ago. And we've basically been building up multidisciplinary teams to give patients the best possible outcomes when they're diagnosed with colorectal cancer and other GI malignancies. And I'm also a colorectal surgeon, and that's what I do as a physician.
And so this all starts with screening specifically. Tell me more about the screening and that process.
Yeah, so there's a variety of methods to screen, but certainly colonoscopy is what we consider the gold standard.
Right.
So, it has the highest likelihood of finding cancer if it's there, and also has a preventative aspect in the sense that if there are polyps or precancerous growths, they can be removed during the colonoscopy, thereby preventing that polyp from turning into a cancer.
And what are some of the symptoms that people might be experiencing if they are on the onset of colon cancer?
Right, so there's a variety of different symptoms that people can have. Blood in the stool, a change in their bowel habits, either going from constipation to diarrhea or vice versa. Change in the size and shape of their stools. Also abdominal pain, nausea, vomiting, unexplained weight loss. There's a variety of different symptoms, but certainly the one you have to take most seriously is not having any symptom whatsoever. And so that's why we recommend screening colonoscopies.
So you could have no symptoms and still have this, so you need the screening.
Absolutely.
So if you get the screening and they find that you do have colon cancer and they're recommending, or you're recommending that there's surgery, will the surgery actually cure someone?
Well, surgery is typically the primary treatment for colon cancer. And depending on the stage of the cancer, surgery can be curative in most cases. Okay. Now, that stresses why getting cancer detected early makes a big difference.
Right. So when should people be getting screenings?
So most societies recommend starting screening at age 50 and then every 10 years. Now, if you have risk factors, either personal history or family history, or you're having symptoms, then you should get screened early. And there are some societies like the American Cancer Society that last year published that they recommend starting screening at age 45.
Wow. Okay, so sometimes getting it earlier even. In addition to surgery, there are other treatments though, correct?
Yes, but typically if the goal of treatment is for cure, then surgery is a critical component to it.
Okay.
There are additional therapies like radiation therapy for rectal cancers or chemotherapy for colon and rectal cancer, but still surgery is the core.
Okay. So right now we know that March is Colon Cancer Awareness Month and that people can reach out to GBMC to get this screening, get more information. You can go online to GBMC's website, gbmc.org/GI-oncology. You're fielding a lot of questions there, and there's a lot of information on the website itself, right?
Absolutely.
Okay, great. So make sure you check that out. You can call the number on your screen as well. Thank you so much for being
here.
You're
welcome,
We
Elsa.
really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.